WHO. Why children should not be vaccinated for the moment. Many experts believe that vaccinating children is key in effectively controlling this pandemic. However, no general recommendation across the globe supports it, at least in the present time. Since there's no sufficient data to support general recommendations, children and teens may not take vaccines based on informed decisions. Still, the data of COVID-19 vaccines on children is being reviewed to warrant a general recommendation. According to Precision Vaccinations, the World Health Organization previously noted, children should not be vaccinated for the moment, with COVID-19 vaccines as part of the June 21 advisory, though this text was no longer present. Instead, the WHO noted that additional evidence is required to generally recommend these vaccines in children. The reasoning behind the latest advisory is this: children and adolescents tend to have milder disease compared to adults. Unless a child is at a higher risk of severe disease, their urgency to be vaccinated is less than older people with chronic illnesses, and healthcare workers. Moreover, the WHO recommends having kids and teens vaccinated for other diseases, including booster shots. COVID-19 isn't the only disease on Earth, and other infectious bugs out there could also lead to poor outcomes. Measles and HPV are examples of infections associated with specific complications. However, both are vaccine preventable. In case the child is at a higher risk, they are advised to be vaccinated against COVID-19. In the US, the WHO's advisory group concluded that the Pfizer-BioNTech vaccine is suitable for people aged 12 and older. This product may be offered to high-risk children aged 12 to 15. For parents, kids vaccinated against COVID should stay in vaccination sites for at least 15 minutes to give health workers the time to monitor possible adverse reactions. Side effects are common, so expect mild fever, arm soreness, muscle aches, and headaches, among others, from the vaccine. But if these effects worsen after 24 hours or didn't subside in a few days, don't hesitate to contact your healthcare provider. Also, getting vaccinated against COVID doesn't mean complacency. While vaccines could greatly decrease the odds of hospitalization and death, no vaccines could provide 100% protection. Thus, it is better to be safe than sorry, not just for yourself but for your loved ones too. Health experts still recommend face masks, physical distancing, and frequent hand washing for vaccinated people.